Hi. Hi, and good afternoon to the live audience that's here right now, and good morning to the viewers for tomorrow. You don't know this, or maybe some of you do know, I'm the safety coach of this department, and safety meetings happen every other month, virtually right now because of COVID, as you know. And I want to introduce to you our little safety corner.
Oh.
I apologize, I meant to update it yesterday, but guess what, we were busy, and I'll try to update them today. And this will include, of course, all of the things that I have to discuss with you as well. It's called EPTs, not the error-proof test for pregnancy, but error prevention tools every month.
Wow.
So I'm also going to be combining the talking points they want me to discuss with you from the May meeting and the July meeting, okay? Normally they want us to start with a safety story, but I'll probably do that safety story to coincide with one of our error prevention tool, communication tool, which is the SBAR. So what they wanted to say is our new norm. This was an update from Camila Kaunaki. She's our Chief Operating Officer. She wants us to be an advocate for a safe, happy, and healthy workplace. Speak up for safety and speak with colleagues when we see that we are not socially distancing, 6 feet apart, wearing their masks or following proper hand hygiene techniques. These things are important to help prevent the spread of any virus or infection. They also want to discuss the CPMC updated visitor policy review. Some of us probably already know this because we get asked these questions. We have 1 visitor per day per patient, no in and out privileges, and no visitors below age 18. All visitors must pass screening questions and temperature check are required, and to wear masks. The visiting hours are from 9 a.m. to 7 p.m. Announcement at 7 p.m. stating that visiting hours have ended helps to reinforce this policy right now. No visitors allowed over in Davis SNF per, I don't know what mandate this is, but they're saying per C19-03 mandate. Visitor access is limited to patient rooms. Visitors are not permitted in cafeterias. No outside food deliveries allowed. And patients who are in semi-private rooms, visitation is assessed on a case-by-case basis. I also wanted to discuss safety officer updates. We need to always be marinating and promoting safe behaviors. Remember, what we permit, we promote. Encourage staff to keep an eye out for common EOC, which is Environment of Care findings. Take the time out to correct and/or report common issues to safety to ensure prompt education and resolution. Remind your teams, departments to also be present and to never sacrifice their safety for the benefit of time. Discuss the department safety corner, which I've already shown you. Safety corner.
Yeah.
Not quite the corner, but at least somewhere. And then also for the CPMC Incident Command and COVID-19 updates. CPMC is still operating a virtual command center under the direction of the incident commander. We continue to focus on infection control guidelines, city ordinances, visitor guidelines restrictions, PPE and supplies, and employee safety. Safety participates in bi-weekly citywide calls with DPH and hospital partners. Calls are to review city response, current cases, out-of-county transfers, and any other operations that may affect citywide hospitals. Safety also works directly with SHEMS, that's Sutter Health Emergency Management System, to monitor supplies, surge protocol updates, etc. And then CPMC injury rates. With the exception of MBCR campus, CPMC injury claims data is trending upward, showing that injuries have resulted in lost time from work and or medical treatment needed. We need to ensure all departments follow safe practices and we all promote safe behaviors. Please remind your department to be cognizant of safe work practices, call safety and or escalate concerns when observed in your departments or the hospital as a whole. Safety has been actively engaged with managers to help reduce injury rates and looking forward to attending additional staff safety huddles. We also want to keep our infection rates low. Again, they always want to reiterate this: wear your mask in public. This helps prevent the spread of the virus when within 6 feet of others. Put your mask on before entering the building. Wash your hands and wash them frequently. Avoid contact with your face. This is the little snippet. Don't touch men. Don't touch your mouth, eyes, and nose. Don't touch men.
I was like,
This is
I was like, what?
This is just my input on that one, okay? Disinfect your workstations and surfaces regularly. Remember, 6 feet apart. Practicing safe social distancing. Break rooms, cafeteria are no exceptions, and as well as elevators. So if the elevators happen to open, there's so many people already, maybe catch the next elevator. Lastly, be safe, take your time, and ensure your safety first always. So now going to the EPT, the error prevention tools. Since I just started just being the safety coach in May, I only had the SBAR, and actually I've already discussed this with a few of you. I remember Rita, Lucy, Meredith, Marilyn. The first one for me is SBAR. SBAR is basically situation, background, assessment, recommendation / request. One of the safety stories I wanted to share regarding this, like, I don't know if you recall, last part of May, early June, we had the issue with the tissue. The tissue allograft for Dr. James Chen's case arrived, was received, no idea where, I had no idea where it was. Serena just told me to follow up on it, only to find finally that it was stored in the freezer where it's not supposed to have been stored at. It's supposed to have been refrigerated. So guess what? If you do communication, they want you to start using SBAR. So the way it was written, like, the situation is the bottom line or the headline. Case canceled because tissue is not deemed to be viable. Background information or details about what happened, maybe when it was received, did not see the sign. Assessment, same thing, case canceled. Recommendation and request. We were wondering, like, maybe we need to have a bigger sign. I don't know how it was outside of the box, if there was an actual instruction on where it's supposed to be stored. But because of that, you probably also recall this, the KDS, know, do, share. This is in the communication book. And because of all that stuff, now we have to have different steps that we need to follow, or extra steps aside from the ones that we normally already do beforehand. So going to June, the next EPT is, let me see where my note is. ARC. ARC is basically another communication thing to prevent, or to basically to have safety. It's speak up for safety using the ARC technique. ARC is speak up for safety using ARC technique. Ask a question for the A, make a request, voice a concern, and if no success, use chain of command. And on that one, how to use this tool. Use ARC when you are uncomfortable speaking plainly about a safety concern. Start with a simple question. If the question doesn't draw their attention to the problem, request a change. Quickly explain why and hand the dialogue back to them by adding, what do you think? If the request did not change their thinking, use the safe word. Express your concern using the phrase, I have a concern. Even then, you still have the chain of command. If they're not listening to you, use your chain of command to check your thinking and help you advocate for safety. Next month, July, ask clarifying questions. And I'm happy to say, I'm so glad everyone today keeps saying, I wanted to clarify. Can I clarify? That is one of the safety things for July. Error prevention tool, they might ask clarifying question. And we often also do this when we do specimen. We ask them, okay, did you say this? Or we always repeat what the surgeon's saying for the specimens. And last but not least, for this month, August, error prevention tool of the month, which I need to put up there, is what they call 5-to-1 feedback. 5-to-1 feedback is offering 5 positives and 1 negative. Where is that? Okay. What you need to know, 5-to-1 feedback is a method for reinforcing behaviors we want people to build habits on. There are 2 types of feedback. The positive or encouraging reinforcement makes an individual more likely to perform a behavior again, recognizing and praising when an individual practices according to expectation. It improves accountability, and it's one's self-motivation to meet an expectation or standard. The next one, the 1 negative, is makes an individual less likely to perform the behavior again. Coach and correct an individual when practice does not meet expectations. They're saying 5-to-1 feedback is like putting money in the trust bank. You're like offering positive reinforcements all the way. And so when you do see something that the person did wrong, that's 1 negative, then they're most likely to trust you because you've been encouraging them before and giving them positive feedbacks. And what else? I think that's it for, do you guys have any questions? Oh, sorry, one last thing. There's a new, My Injury Connection is reporting of injury. And we find this on reporting injury or illness employee quick view. You can show them the video tomorrow. The one I wanted to tell you is, sorry, you can find it on the homepage, and it's gonna be under injury. And let me just play that video. It just introduces you. And I don't know if
Welcome to My